Where I like to go is, again, start up really high like we did for prox aorta, where the rib cage meets up here, and then use the left lobe of the liver as window to see it. If you start down here and try to angle up to it, this is all intestine and bowel, so you're just angling through bowel gas, which doesn't make sense. So come up here and use that liver tissue as your acoustic window to see the pancreas. And hers shows up really beautifully. I don't know if you guys can see that. It's this structure here. Outline it. So just like this. That's the portal splenic confluence and the splenic vein. There's SMA and aorta and IVC, and then this is duodenum up here. On a lot of patients, the general population can't always see pancreas, so do your best. Have them take a breath in and hold it. Have them push their belly out, which works a lot for pancreas. But if you can't see it, a lot of times what we take is an attempt picture. Okay? We don't spend like 10 minutes just trying to see the pancreas when we're scanning the liver. All right, so then I start long. I do want to preface this by saying the way your guys' liver protocol is set up is not going to be how you see it done all the time. Liver is one of the ones where you'll see it done differently a lot, and it's to sonographer preference. And it's not that it's different images, it's just the order in which we get them is different. I left this protocol the way it was when I first took this job because the person who made it said it was one of the easier ways she found to teach students. I don't know if I found that to be true or not because you guys think liver is hard no matter what. So the way that's set up is not actually the way I scan liver. And so the way it has you guys do it is you start and you do left lobe. So we're starting basically over here at the lateral edge and we're sweeping through until we get here. So this is our last left lobe image at IVC, and once I go past that, I'm into right lobe. So the way I do my livers is I would start with long left lobe, and then when I got here, I would just keep going this way for long right lobe. But the way your guys' is set up is you come here, and then you stop, and then you come out here. So you're doing like this, like this. So you start out here and come in and stop, and then you come out here and stop. The way some people do it is they'll do the whole long left lobe, and then they'll do the whole transverse left lobe, and then they'll do long right lobe and then transverse left lobe. So you just might see it done differently some places, and that's fine. In the end, we're all still getting the same images, okay? All right, so long left lobe, the first image is at the lateral edge. That's the landmark you guys have. So basically that just means I want to scan until I don't see left lobe anymore. So I'm angling towards her left side. And some people have a really large left lobe and some people have a really small left lobe. The person we scanned earlier this morning had a really large left lobe, so just like kept going and going and going. So the biggest thing is just make sure you scan all the way through because cysts and masses are just as likely to sit over here as they are here. So you don't want to skip the edge of something just because it's harder to get to. All right, take a breath in and hold it for me. So I'm gonna sweep through all the way to the edge, make sure there's nothing there. Then I'm just going to come back in and take like a nice little representative picture. Go ahead and breathe of this long left lobe. And then if you guys want, you can label at this point so that you remember when you get home once what you can put like at lateral edge or something like that. Alright, so then the next step is at aorta. So I was here and I'm just going to keep stepping through, looking all the way. And I'm going to take an image here at aorta. Take another breath in and hold it for me. And again, just making sure that I'm keeping the liver in view the whole time. So if you have someone with a larger left lobe, it'll want to kind of go off screen here. So you can widen your field of view. See how I can make it smaller or bigger. If you have someone who has a larger left lobe, widen that so that you're not, I don't want to be cutting off this part or this part, okay? So next is at the caudate lobe. Go ahead and take a breath in and hold. So here was my lateral edge, here's my aorta, and now I'm at caudate lobe, which on her is right here. Go ahead and breathe. So this is left lobe. Here's that ligamentum venosum right there, and then this is caudate lobe right here. And then my last one's going to be at IVC. Breath in and hold. I keep having her take a breath in. Go ahead and breathe. Because hers is sitting just high, and I can't get any higher because I'm running into her sternum, so when she takes a breath in, it pushes it down to where I can get to it. So that's my last left lobe, long left lobe picture. After that, I'm into right lobe. So I actually didn't really move my probe at all. I just angled in between here in this little opening between the rib cage right here. So now we're gonna go to right lobe. So if I was scanning, if she was my patient, I would keep going here, here, here. So I would just keep going all in one fell swoop this way. But the way your guys' protocol is set up is it has you go all the way out to the side of the right. And since the right lobe is so large, we're basically gonna take pictures through here and then come down and take them down here. Because it's so large, we can't get it all in at once. Okay, take a really deep breath in and hold it for me. So the next one is sag right dome. So basically that just means all the way out to this lateral edge, and make sure you keep going so that there's nothing there that shouldn't be. So I go all the way out, and then I come back and just kind of take a nice representative picture of the dome area. And then the next one is at main lobar fissure, which is right in here. Just go ahead and take a breath for me. And then after that, it's at gallbladder, which is very close in the same area. Whenever you're ready. So there's her gallbladder. And then the next one is at common bile duct, which is right there. Go ahead and breathe. So you'll notice I kept my depth and my focus set down here, even though my landmarks were way up here. Those are just my stopping points so that I know where to take a picture. But I want to make sure I'm showing the whole liver. So this is where it gets confusing, and you all might want to get out a pen and change this because I forgot to change the labeling. For number 10, we just did number 9. Now we're going to take a little pause on the liver and take a minute to look at the common bile duct individually. So change the labeling to long common bile duct, that way it doesn't confuse you later.
For number 10?
Yeah, number 10. When I do this at work, I save common bile duct for the very end, but it doesn't really matter as long as you get it in. Okay, common bile duct is one that everybody struggles with, but you guys do need to get really good at it. You will see it on at least one or probably more practicals, so make sure you practice it. So we talked about that main portal triad, how portal veins, hepatic arteries, and bile ducts all run together. And the main portal triad we look at is our main portal vein, our hepatic artery, and our common bile duct. So go ahead and take a breath in and hold it for me. Go ahead and breathe. Roll on your side. Go ahead and roll up on your side for me. Go ahead and roll this shoulder back just a little bit. So I like LPO for common bile duct. Can you see stuff? So I like to start right up here in this little space up near that xiphoid process. And then all you do is angle in just a little bit until you can see, take a breath, until you can see your portal vein and your hepatic artery. And then from there, I'm just trying to find that common bile duct. You have to use color to confirm. Go ahead and breathe. And this is hers. It's easier to see when I turn color off. So this is portal vein. See that tiny little round hepatic artery? And then this is the duct. So the duct actually starts here. This is considered hepatic duct. Crosses over the top of the hepatic artery, or sometimes under, just a normal variant on people. And then it becomes the common bile duct. It's like those streets where it's got one name and then you cross an intersection and suddenly it's a totally different name street, but still the same street. It's like this. So hepatic duct crosses over hepatic artery and becomes common bile duct. All right? So we take an image with color to confirm, and then we take one without, and then we measure. And ducts are measured inner wall to inner wall. So when we measured aorta, you included the wall. When you do ducts, you do not include the wall. I think I also have you guys measure hepatic duct on there too. Mine wasn't showing up well enough to measure it there. Go ahead and take a breath in and hold. See if I can get it again. Common bile duct was showing up nicely there. So there's hepatic ducting where you can breathe. So measure that one here.
And you said with ducts, how do you measure that again?
So it's inner wall to inner wall. I wonder, see if I can zoom for you guys. I don't like to use Zoom, but a lot of people do when they're measuring very small things. So I'm just placing the caliper up underneath that right echogenic wall. And then this one just right on top of the other one, see? So that's how we measure ducts. Okay, so I deviated kind of from liver. We measured and looked at the common bile duct. Now I'm just gonna get back to liver. Okay, you can go ahead and lay back on your back so you can see more. All right, so we started here with long left lobe and went in. Then we went out and got dome, and we got lobar fissure, gallbladder, common bile duct. But that didn't cover this lower part of the right lobe because the right lobe is so big. So go ahead and take a breath in and hold it. Our next image doesn't really have a landmark because it's just a big old chunk of liver tissue with no specific landmarks in it. So I just call this liver parenchyma for you guys. So basically just a big old chunk of liver tissue. And then next is going to be with mid-clavicular line measurement. So I'll show you guys how to do that. So again, just kind of straight down here. Take a deep breath in and hold it for me. Good. So I'm just trying to stay perpendicular, straight up and down. Go ahead and breathe. So this is where I'm going to measure. It's actually liver length. So don't include diaphragm in your measurement because it's not part of the liver. And then all the way to that inferior portion right there. And then I'm going to look at her liver kidney interface. Go ahead and take a deep breath in and hold. A lot of times, if the kidney is kind of gassed out like it is right there, I will roll them up. I'm not going to make her roll again because that's mean. Go ahead and breathe. But obviously, you can't really rule out that there's anything on this inferior pole. So ideally, you would roll her up so that you can see it. And usually, that does the trick to get rid of the bowel gas. If not, you may have to come through the ribs. I think that was the last long one. Am I correct? I skipped one. I'm getting jello in my nose. So now we're going on to transverse left lobe of liver. So for this, I like to angle all the way up to where I see the heart. And then I come back down. That's my first picture. That's transverse left lobe of liver. Don't take a breath in and hold it for me. So there's her heart. And I'm just coming back in here and taking a picture. And then next is with left portal vein. Go ahead and breathe. This is her left portal vein here. Here's one of her branches. So you can kind of see, like, you can breathe normally for a second. You can kind of see how it's like a weird little body with the little arms. A lot of students are like, I can't get it with both branches and show the liver. I don't really care. As long as you're here at the left portal vein and you're showing me left liver, don't show me this. I don't want to see this and not see the left lobe of the liver. Does that make sense to everybody? Breath in again and hold it. I think I have it on there for you guys to label